Now we will be conducting the de Quervain's assessment. So for radial-sided tendinitis, de Quervain's is right here on this compartment, the first compartment, followed by the intersection syndrome, where the first dorsal compartment intersects with the second dorsal compartment, right about here. To test for that, you apply resistance to an extended wrist as you palpate in this area. Patients can also have the symptoms of a thumb triggering, right here. So if they try to flex and extend the thumb, they might feel a pop. You also want to check the MCP joints. Okay. For the patients with the digital triggering, they will feel pain in the nodule along the flexor tendon at the thumb, at the level of the A1 pulley of the fibrous sheath, which I have drawn right here. So they would flex and extend the thumb. Also, while you palpate at the MCP joint, while the person flexes and extends at the fingers, so you want to palpate as they extend and flex the fingers, you will feel the clicking if they do feel any pain in that area. When examining the flexor carpi radialis or the flexor carpi ulnaris, so we have the radialis inserting right about here, and the flexor carpi ulnaris right about over here. So for the flexor carpi radialis, you want to have the wrist flexed up as you apply resistance, and you palpate in this area. You will see it right here. And the flexor carpi ulnaris tendon runs along here. And the same thing occurs, although it is not a common problem. Also, ulnar deviation will elicit a painful response in this region. Patients also have PC triquetral arthritis. So we have the PC form right about in this area. Pain will be elicited there with ulnar deviation and flexion while palpating the PC form. For the flexor carpi ulnaris, runs through the ulnar head and it can dislocate, causing pain. To test for that, you supinate the forearm and extend the wrist. Extensor pollicis longus, as you see on this side, runs through Lister's tubercle, which would be around here on the radius. For the flexor carpi ulnaris, runs the ulnar head, and it can dislocate, causing pain, right over here. So to test for that, you want to supinate the forearm as you extend the wrist, and you apply resistance. Extensor pollicis longus is right here in the third compartment of the dorsal part of the wrist, runs through Lister's tubercle on the radius around this area. So resisted thumb extension while palpating Lister's tubercle will elicit a response. Resisted finger extension while palpating on the fourth compartment right here will elicit a response as well.